See some of those videos, Randy. It's always fun to see young players, young athletes imitating the big leaguers, as long as they don't go crazy and throw out their arm. We've got Dr. Alex Badan joining us, and you've seen some patients, some kids who overdo it.
Oh yeah, we see that every season. You know, we'll see the kids that are overdoing it. They're doing too much. They're not following their pitch counts and everything else. So we want to make sure that we let them know what they need to be doing.
Some new recommendations out too. Major League Baseball's pitching guide, as well as the American Sports Medicine Institute, coming out with suggestions that kids should follow. Moms and dads should make sure they do that.
Yeah, this is something that moms and dads need to be aware of, coaches need to be aware of, players need to be aware of. Everyone needs to know exactly what they should be doing to make sure that these athletes stay healthy, young, strong. MLB wants to make sure that they're doing that too.
What are some of the ailments, the common ailments that you run into?
Common ailments that we'll run into are things like, obviously shoulder pain in the front, back. A big one that we'll see too is because of how this shoulder complex ties into what happens with the neck and the upper back, is something that we specialize into, and making sure that all that ties in together to keep that athlete on the field and playing the way they should be.
Is this self-induced pressure? Is this emulating the big stars, or is this coming from coaches? I mean,
I think it comes from all different aspects, right? You see the big leaguers and you see them doing what they're doing, and you think, I want to be that guy. I want to be doing that. And you start looking at it from that perspective, and you start saying, I can go a couple more innings. When that arm fatigue starts kicking up, we start to see that most players, when they haven't done their due diligence of making sure that as that arm fatigue is there and those signs and symptoms are there too, they're 36 times more likely to have had problems in the past of regularly pitching with that arm fatigue. And so a lot of those players end up having things like arm surgery, shoulder surgery, elbow surgery, things like that.
Pitching too many innings. They found that players who pitch more than 100 innings in at least 1 year were 3.5 times more likely to be injured than those who did not exceed 100 innings pitched.
And that's big. I mean, you have to look at that. 3.5 times more likely to have had these times where they're having these injuries and these traumas that are going on.
And it's the kind of pitches that they throw too. There are some no-nos, you know?
Right. Yeah, so it's age appropriate within that as well, right? We've got to look out for things like curveballs or breaking balls or whatever it happens to be. You've got to make sure that you're doing it the right way and you're not pitching too many fastballs and all those things. So they've got guidelines for all that as well, just to ensure that that arm stays healthy and strong.
What are some signs that parents can look for as far as
Parents
injuries?
need to look out for things as far as injuries of knowing their player, knowing whenever their player, their kid is pitching. Whenever they're doing that, they need to know, all right, I know that he usually does this or she usually does that. That's their normal, how they operate. But when they aren't operating that way, know your child, know that you see them kind of shifting their arm around a little bit more. Know that you notice them doing a few more, where they're kind of doing a few things with their arm here and there. When you see those things happening, that's a cue, a mental cue to know, hey, I should ask him at the next inning, how's that arm holding up? What's going on? And knowing your player, knowing whether or not you can ask that direct question of, hey, how's that arm holding up? Or, hey, you're looking like that arm's a little tired. Let's look at some things here.
All right, Dr. Alex Badan, thank you so much. I can tell you played ball at one time. You've got little leaguers in the family.
Yeah, for sure.
We appreciate it. Let's go back to Randy.